Press this specific spot for 10 seconds before bed, and your prostate will drain accumulated fluid while you sleep. I know that sounds strange. Most men have never heard of this technique, but it's based on lymphatic drainage principles that urologists have understood for decades and rarely teach patients because it seems too simple to be effective. But it works, and you'll feel the difference the first morning after you try it. Let me show you exactly where this spot is, why pressing it works, and what's actually happening when you do this. First, understand what accumulates in your prostate throughout the day. Your prostate produces fluid constantly, but it also accumulates interstitial fluid, lymphatic fluid, that pools in the tissue surrounding the gland. This fluid contains metabolic waste products, inflammatory compounds, and cellular debris that your lymphatic system is supposed to clear, but often doesn't efficiently in men over 60. When this fluid accumulates, it creates swelling. Not dramatic visible swelling, but enough to increase pressure inside the prostatic capsule. That pressure contributes to urinary symptoms, nighttime frequency, and the sensation of pelvic heaviness many men describe but don't understand. Your lymphatic system has pumps, tiny muscular vessels that move fluid through the network toward drainage points. But unlike your cardiovascular system, with its central heart pump, the lymphatic system relies on muscle movement and external pressure to function effectively. In younger men with better overall circulation and more physical activity, lymphatic drainage from the prostate happens naturally throughout the day. But in older men, especially those who sit extensively, lymphatic flow in the pelvic region becomes sluggish. Fluid accumulates faster than it drains. Here's where the technique comes in. There's a specific point in your perineum, the area between your scrotum and anus, that sits directly over a major lymphatic drainage pathway for the prostate. Applying sustained pressure to this point for 10 seconds creates a compression and release effect that manually pushes accumulated fluid into the lymphatic channels. Think of it like squeezing a sponge. The pressure forces fluid out of the prostatic tissue and into the drainage pathways. Then when you release, fresh fluid can flow in, bringing oxygen and nutrients, while carrying away waste products. The exact location is about 1 inch forward from your anus, directly in the center of the perineum. You'll feel a slightly softer area compared to the surrounding tissue. That's the spot. Here's how to do this correctly. Sit on the edge of your bed or lie on your side. Use your index and middle fingers together. Apply firm, sustained pressure directly on that central perineum point. Not poking, not massaging, just steady, firm pressure straight down toward your spine. You should feel a dull sensation of pressure internally, like you're pressing on something beneath the surface. That's your prostate. If you feel sharp pain, you're pressing too hard or in the wrong location. Adjust until you find the spot where firm pressure creates dull internal sensation without pain. Hold for 10 seconds. Count slowly. 1,000, 2 1,000, all the way to 10. Keep the pressure completely steady throughout. Then release slowly over 2 seconds. Don't just let go abruptly. Gradually decrease pressure. That's the entire technique. 10 seconds of sustained pressure, once per night before bed. Here's what happens biologically when you do this. The mechanical pressure compresses the lymphatic vessels in that region. Fluid that was pooling in and around your prostate gets pushed forward into larger lymphatic channels that drain toward your inguinal lymph nodes. At the same time, the pressure stimulates mechanoreceptors in the tissue. These receptors signal the autonomic nervous system to increase lymphatic pump activity. The tiny, muscular vessels that move lymph start contracting more frequently and more forcefully. This effect lasts for several hours after you release the pressure. So doing this right before bed means your lymphatic system is more active throughout the night, continuously draining accumulated fluid, while you sleep. By morning, the swelling in your prostatic tissue has decreased. The gland is slightly smaller. Pressure on your bladder and urethra is reduced. You wake up with less urgency, better stream, and often you've slept longer stretches without needing to urinate. Most men notice the difference after the first night. Not dramatic transformation, but noticeable improvement. After 7 consecutive nights, the cumulative effect becomes obvious. Now here's what makes this particularly effective compared to other approaches. Supplements and medications work systemically. They affect your entire body to eventually influence prostate tissue. This technique works directly and immediately on the specific area that needs drainage. Kegel exercises strengthen pelvic floor muscles, but don't address fluid accumulation. In fact, excessive Kegel practice can increase pelvic floor tension, which restricts lymphatic flow. This technique releases rather than tenses. Dietary changes reduce inflammation over time, which is valuable, but they don't actively drain fluid that's already accumulated. This does both. It drains existing accumulation, and it stimulates ongoing drainage. If you want to enhance this technique with approaches that support overall prostate health and reduce the rate of fluid accumulation, some men have found natural options helpful. I've linked a resource below that covers what research shows about supporting lymphatic function and reducing prostatic inflammation. The pressure technique alone makes a significant difference. Combined with other approaches, results can be more comprehensive. You should feel a few specific things that tell you you're doing this correctly. During the 10 seconds of pressure, you'll feel a dull internal sensation, like something is being compressed. Not pain, just awareness of pressure, deeper than the surface. Immediately after releasing, you might feel a slight tingling or warmth in the perineum area. That's increased blood flow and lymphatic activation. It fades within a minute or two. Within an hour of doing this, some men notice they need to urinate more urgently than usual. That's accumulated fluid that was drained from the prostate now moving through your system. It's actually a positive sign the technique is working. The next morning, you should notice at least one of these changes. Stronger initial stream, less urgency upon waking, longer sleep stretch before needing the bathroom, more complete emptying sensation after urinating. If you don't notice anything after 3 nights, you're likely not finding the correct spot or not applying enough pressure. The spot should be directly center, not off to one side, and the pressure should be firm enough to create that internal sensation. A few important points about safety and when not to use this technique. If you have acute prostatitis, active infection, or severe pain in the prostate region, don't use this technique until the infection is treated. The pressure could spread bacteria or worsen acute inflammation. If you've had recent prostate surgery or biopsy within the past month, wait until you're fully healed before trying this. The tissue needs time to recover without additional mechanical stress. If you're on blood thinners, use lighter pressure. You still want to create the drainage effect, but without risking any bruising in the delicate tissue. For most men with benign prostatic hyperplasia and chronic symptoms, this technique is safe and effective. But if you have any concerns, mention it to your doctor. Most urologists are familiar with lymphatic drainage concepts, even if they don't routinely teach this specific technique to patients. Here's what makes this approach different from everything else you've probably tried. It's mechanical, not chemical. It works immediately, not eventually. It requires 10 seconds, not 30 minutes of exercise or meditation. It costs nothing. It has no side effects. And you can verify whether it works for you within just 3 nights. Most prostate interventions ask you to commit to months of supplements or lifestyle changes before you know if they're helping. This gives you feedback within days. The reason this technique isn't more widely known, has nothing to do with effectiveness and everything to do with medical culture. It's too simple. It's not pharmaceutical. It's not surgical. It doesn't generate revenue, so it doesn't get taught in medical schools or promoted in patient education materials. But the underlying physiology is solid. Lymphatic drainage through manual pressure is established medical practice for multiple conditions. Applying it specifically to prostate health is just an extension of the same principles. 10 seconds, one spot, before bed, every night for 7 days. That's all you need to determine if this works for your specific situation. Comment below after you try it for a week. Tell me what changes you noticed. I want to hear real results from real people. The resource about comprehensive approaches for prostate health and lymphatic support is linked below if you want additional information beyond this technique. But start with this. Tonight before bed, find the spot. Apply firm pressure for 10 seconds. See what you notice tomorrow morning. Let me know your questions. I read every comment.